Today, we have Dr. Patrick Hanley, who is the director of our cell and gene therapy program here at Children's National. He oversees the production and the delivery of cell and gene products to children. Why don't you just tell the listeners what are the great things that we're doing in precision medicine, cell therapy, gene therapy here at Children's National, and if you could also mention other things that are happening nationally in this regard.
So I'll just preface by saying I'm not a physician, but from my perspective, healthcare has really changed in the last 10 years as it pertains to cell and gene therapy, because the first cell therapy or gene therapy was approved in 2017. And so we're still trying to grapple with how do we deliver these products, because you need to create an infrastructure. The toxicities that can be associated with these are significant. And so when we first delivered, Kymriah was the first one approved. We had to train, I think, 713 staff throughout the entire hospital, emergency room physicians like yourself, nurses, neurologists, because they could show up at the ER after receiving these genetically modified products. So it took us till about 2020 to understand how to deliver these products. And now it's a pretty smooth process. But fast forward to 2023 with the approval of, on the same day, 2 sickle cell gene therapy products, Lyfgenia and Casgevy. And you may remember, we were actually the first to infuse Lyfgenia to a patient with sickle cell disease on September 11th, 2024. That's the state of the field, if you will. These are personalized therapies for these patients. It's not chemotherapy, radiation, that is just standard for everyone that's receiving it. These have to be made for each patient. Now, in order to deliver these safely, you have to have the infrastructure, which I talked about, and many hospitals in the country and throughout the world don't have that infrastructure. So Children's National is really working to partner with other institutions to say, hey, we have this infrastructure. Let's make sure that every patient, every child that needs this care has access to it. And so, we're building those relationships on the clinical side. And then on the research side, we're also developing our own investigator-initiated clinical trials where we can treat patients with pediatric solid tumors, with viral infections, with brain tumors. And in order to make sure that those patients have access, we're doing something similar. We're building a relationship with the researchers and also the hospitals really nationwide, because we do see so many referrals from across the country, highly specialized treatments that are only available at Children's National and a few other hospitals.
Sickle cell gene therapy has been transformative in the world, and getting this to scale so that every child in need receives it is, of course, going to be an important challenge. But I see how you and our network here at Children's National are trying to get there. What are you excited about in the next 5 to 10 years in personalized medicine, specifically with regard to cell and gene therapy? What do you foresee happening in the next several years?
First of all, I'm very excited to be here, where I think the vision of this hospital aligns with what we're trying to do in the field of cell and gene therapy, very forward-thinking and innovative. So thank you for your support, and also to Michelle Bradley-Bond, the CEO of Children's National. But what I'm excited about is that we are finally delivering these cell and gene therapies to the patients that need them. So I talked about how access is still a little bit of a problem. We're getting there. When I started training 20 years ago, there were a handful of centers that could develop these investigator-initiated trials for patients with cancer or immune disorders. Now, we have these approved drugs, and we're working to make sure that these patients are getting them. It's no longer a science or a medicine problem. It's an issue of commercialization and business strategy. So you have these rare diseases. How do you ensure that patients with rare diseases are getting these therapies when a company may not want to invest because the return won't be sufficient? So that doesn't excite me. But what excites me is that I think we can find an answer to how to deliver those in novel ways. And that's what we're doing at Children's National, whether it be a regional hub for virus-specific T cells and CAR T cell targeting solid tumors, which was highlighted in the Washington Post a couple of months ago.
Yes, indeed.
Or whether it's helping other programs across the country with our Cell Builder program to say hey, we want to partner with you so that you can make your own cell and gene therapies to increase access to patients. That's what I'm excited about. I want to sort of temper that by saying it takes a lot of specialized people, whether it be faculty, whether it be highly skilled staff that manufacture the product, or whether it be the environmental services team that has to clean our clean facility every day so that we can manufacture those cell and gene therapy products safely. It takes a lot of special people, and it's very expensive. We have federal grants, we have foundation grants, but really what makes this happen is the generosity of donors and people who want to invest in the future of healthcare and medicine at innovative places like Children's National.
Great, Patrick. Thank you so much for what you do and actually for what your whole team does. And thank you for joining us on the Lead in Peds Unplugged today. And to our viewers, I hope you've enjoyed this brief snippet of the Lead in Peds Unplugged. And to hear about all the innovation in science that we're doing at Children's National, please watch our full episodes of the Lead in Peds wherever you download your podcasts. Thanks for joining us today.